Peripheral neuropathy is a serious challenge for those who suffer. Dr. Dwayne Ackerman is back to talk about this particular issue and how our own diets can impact our getting better or getting worse. Good to see you.
How are you this morning?
I'm very good. I'm very good. And you know, nobody wants to talk about the stuff they eat, as you well know, and how it affects us, because we just want to eat what we want to eat.
I know. And when I mention this stuff to our patients, a lot of them don't like to hear what I have to say. But if you show up, if you're in my office, you've got a chronic disorder, and we want to do everything we can to improve that. And we've talked about different techniques that we use over the years we've been on here. In the past months, I've really been doing a deep dive into what causes the chronic inflammation, the problems that we have. And the interesting thing was, this took me all the way back to 1977. I'm in grade school, and they come out with cholesterol causes heart attacks.
Yes.
And since 1977, guess what has skyrocketed? Heart attacks, chronic disorders, diabetes, dementia, all of these chronic disorders that our generation is now experiencing because they were wrong. It's not cholesterol and fat that's the problem, it's sugar. So we all got off of these. Meat was bad, eggs were bad, butter was bad, all of these things
anything
were
rich
bad
was
to lower cholesterol. Well, all these other chronic health conditions have now arisen from a shift in that. I mean, and I preached that early in my career, you know, cholesterol's bad, fat's bad, yada, yada, yada.
Well, and that's, again, control. I mean, a marginal use throughout for those as well.
Right, and then, but you know, when you get to the stage where you're coming in to see me with peripheral neuropathy because your balance is terrible, your feet are terrible, you can't feel them, you're kind of backed into a corner. So we've kind of got to do some extreme things to try and get that reverse years and years and years of chronic health issues.
So what I'm hearing you say is, if that's not your issue now, if you don't have neuropathy, but so how do you delay it? How do you avoid it? So you eat what?
The biggest thing is sugar is the most corrosive thing we can have. And if you look on a label, it'll say carbohydrates, then it'll say sugar.
Right.
A lot of patients mistakenly say, well, it just has 3 grams of sugar, but it's got 30 grams of carbohydrates. They're the same thing. They're both sugar. And that's what's causing all this chronic inflammation, the diabetes, the chronic inflammatory diseases, the chronic bowel disorders, all of this stuff. So that it really helps when I can get a patient that will start taking steps that improves their neuropathy faster. I had a patient yesterday, he's lost 15 pounds in a month, and all he did was cut back on his carbs.
Makes a difference.
He's feeling better. His feet are feeling better, all of that stuff. So it all plays a role in trying to figure out how to treat these chronic disorders.
Well, and it makes sense. I mean, we are responsible for what we put in our bodies. As much as you want to cheer us on and eat the right things, ultimately we have to be the ones to be mature enough to know, I want to be well and stay well. Yeah.
Yep. And I've done a little experiment with me the past month. Purely meat. No veggies, no carbs, no nothing. And I've actually felt better than I have felt in years, and it's the only diet I've ever been on where I actually felt different. And, you know, that's a pretty extreme thing.
It is.
There's a lot of medical community that's now actually going towards that out there. They're kind of on the fringe, but there's some out there talking about it. So it's really interesting stuff about how our diets are really affecting us more than we probably think.
And we have power to make a change. Thank you, Dwayne.